Om Swastiastu. Good morning. We're from SGDB 7, the third semester of PSSK 2021. Today we will present our student project presentation, which title is Hemophilia A. Next slide. And these are our members. Next slide. Okay, chapter 1 introduction. Next slide. So before I begin my presentation, let me introduce myself. My name is Ledwin Wibisono with the last three digits of student number 061. Now I'll explain about background. Next slide. So hemophilia is one of the most prevalent inherited bleeding disorders that, if left untreated, can result in chronic bleeding tendencies and lifelong disability. Hemophilia affects approximately 1,125,000 people worldwide, and 80% of them are in developing countries like Indonesia. And in 2021, there are 98,225 cases of hemophilia in Indonesia. So hemophilia is categorized as a batch of X-linked inherited hemorrhagic abnormality caused by a lack or malfunction in crucial components of the coagulation cascade. There are two most common forms of hemophilia, which is hemophilia A, the lacking clotting factor of 8, and hemophilia B, which lack clotting factor 9. And so hemophilia A is more common than hemophilia B, with the prevalence of 1 in 5,000 male live births compared to 1 in 30,000 male live births. And so hemophilia can cause internal bleeding in the joint or hematrosis, brain bleeding that might result in long-term issues like seizure and paralysis, and even can lead to death if the bleeding does not stop in certain organs like the brain. And due to more severe joint abnormalities and severe clinical symptoms and a tendency to bleed more frequently, hemophilia A is more severe than hemophilia B. And according to many studies, a person with hemophilia A is more likely to develop hematrosis and undergoing arthroplasty. Next.
Okay, let me introduce myself. My name is Satya Wijaya with the last digit of student ID number 227. And I would like to continue explaining the background of this student project. Hemophilia has many negative effects on the body that cause difficulty in daily activities, such as impairing mobility, causing unexpected bleeding, inflicting pain, and creating uncertainty in typically mundane activities. Not to forget that the most prevalent form of hemophilia is hemophilia A, which carries a higher risk and worse outcomes than other types of hemophilia. If left untreated, it can lead to bad prognosis in the future. And so, it is really important to discuss and research more about hemophilia A. Next slide. Now I would like to explain about the problem formulations in the student project. Based on the background, the formulations of problem to be discussed in the student project are as the following. What is the history and definition of hemophilia A? What is the etiology of hemophilia A? What kind of signs and symptoms are present in hemophilia A? How is hemophilia A diagnosed? What are the complications of hemophilia A? What are the possible treatments of hemophilia A? And lastly, what are the possible prognosis for patients with hemophilia A? That's all from me. Thank you.
Okay, hello, thank you for the opportunity. My name is Wilbert Purnamsidi with last three digit of my student number is 135. And now I will explain about the objectives and the benefits of this literature. Okay, the first one, about the objectives of this literature. We have 7 objectives of this literature. The first one is to understand more about the history and definition of hemophilia A, and to know the etiology, to know the signs and symptoms of hemophilia A, to know how to diagnose hemophilia A, to know the complication, to know how to treat hemophilia A, and to know what is the possible prognosis of hemophilia A. And the next one is benefits. We have 3 major benefits of this literature. The first one is benefits for writers. The second one is benefits for institution, and the third one is benefits for public community. For the benefits for writers, we have 3. The first one is this paper can be used for educational resources. The second one is practicing and developing skills to conduct research. The third one is improving literacy skills. And benefits for institution, we have 3 also. The first one is adding sources of learning material, especially about hemophilia A. The second one is adding sources of knowledge to introduce hemophilia A. And the third one is can be used, this literature can be used as a reference for conducting research. And benefits for public community, we have 3 also. The first one is introducing to the public community, to the public about what hemophilia A is, increasing public awareness about hemophilia A, and can be as a guide to know the general knowledge about hemophilia A. Okay, maybe that's all from me. I give it to my friend. Thank you.
Good morning, my name is Gregorius Thongiratama with class digit name 085. Now I'm going to present about the definition of hemophilia A. Hemophilia A is an X-linked hereditary bleeding disorder caused by abnormalities in the FA gene, causing the level of coagulation factor A fall below the normal range. Hemophilia severity based on the factor activity level could be classified into mild, moderate, and severe. And most patients tend to have severe hemophilia that could induce spontaneous bleeding in case of surgery, operation, or trauma. Subsequently, misdiagnosed hemophilia frequently happens in mild hemophilia, enhancing the risk for spontaneous bleeding. And hemophilia A as a hereditary disorder involves missense, deletions, or nonsense mutation. And these types of mutation are associated with disease severity, which mild and moderate are more commonly associated with missense mutation. That's all from me, and thank you.
My name is Natania Sutedja with 3 last digit of student number 175. Next. And today I will explain about etiology of hemophilia A. Hemophilia is typically an inherited condition that are caused by the lack of clotting factors in blood. Most of the deficiency is caused by the defect or mutation of the gene that encodes clotting factor. Inherited hemophilia is transferred via X-linked recessive pattern in such a way that females born from affected father are bound to have the gene mutation with the males unaffected. Female carriers have a 50% chance to have affected male or female carrier females. However, in the condition where a female child is born from an affected mother with the absence of X chromosome, the child could also be affected. Aside from the inherited hemophilia, there are some cases where hemophilia is acquired by some condition through life. Around 20% of acquired hemophilia cases are associated with malignancies, with around 1/3 of them associated with hematological malignancies, such as chronic lymphatic leukemia, lymphoma, and plasma cell disorders. Other than malignancies, autoimmune disorder can also be one of the causes of acquired hemophilia. It is the second most common cause of acquired hemophilia, including systemic lupus erythematosus, rheumatoid arthritis, and immune-mediated dermatological disease. There are several cases of acquired hemophilia associated with the use of certain drugs, such as alemtuzumab, in multiple sclerosis patients and immune checkpoint inhibitors, such as pembrolizumab, in patients with diabetes. That's all from me. Thank you very much.
Hello, good morning, everyone. My name is Devi Prastiti with class 3 digit number 028, and now I will explain about the pathology of hemophilia A. Next slide. So hemophilia A is caused by a deficiency in factor VIII by F8 gene mutation, which is necessary for thrombin production to be enhanced and fibrin formation to be promoted in order to stop additional bleeding. Von Willebrand factor is shielded from proteolytic degradation by factor VIII adhering to it. In hemophilia A, inadequate fibrin synthesis leads to improper fibrin stabilization, which in turn affects secondary hemostasis and results in bleeding. Thrombin shortage in the coagulation cascade leads to a lack of fibrin, and these deficiencies lead to hemophilia A symptoms. That's all for me. Thank you.
Thank you for the opportunity. My name is Nathalie with last 3 digit of student number is 101. Next, I will explain about common signs and symptoms of hemophilia, which are the first one is hematrosis or bleeding into the joints. This can cause progressive pain, and the joint usually becomes swollen, warm, and exhibit limited motion. The joints that are usually affected included knees, elbow, ankles, shoulders, wrists, and hips. The second one is hematomas, or bleeding into the skin or muscle and soft tissue. If left untreated, hematomas have a tendency to enlarge progressively and to all directions. The third one is hematuria. The color of the urine may be brown or red depending the rate of the bleeding. The fourth one is mucous membrane hemorrhage, such as epistaxis or nosebleed and hemoptysis. The last one is dental and surgical bleeding. Dental extraction and surgery can cause excessive bleeding in patients with hemophilia. That's all from me. Thank you.
I will continue the presentations. My name is Felix Djuanda with release digit of student number 117. Next. Okay, today I will explain about the diagnosis. Hemophilia diagnosis can be helped with a few things. The first one is known family history. The second is severe bleeding out of proportions to the traumatic events and abnormally activated peritoneal thromboplastin time. These are a few signs that can be used for diagnosis of the hemophilia. But for the confirmation of the diagnosis, that is recommended to use anti-factor H, ELISA, and Bethesda or Bethesda assay. Bethesda assay is usually great for diagnosing the congenital hemophilia A, but it's affected by the lupus anticoagulant. So we should use immunoassay to rule out the lupus anticoagulant. That's for me. Thank you.
Hello, my name is Marta and my last digit of student number is 064. Now I'll talk about the complications. Next, hemophilia A patients are able to live a normal life if they get good treatment and have regular checkups, but even with good treatment, the possibility of complications still exists. The following are complications of the joint. Damage to the joint is the most common complication. This damage results from repeated bleeding in the synovium and cartilage around the bone. The most commonly affected area are the knees, ankles, and the elbows. Second, bleeding in the brain. Patients with very low clotting factor need to be watched carefully because something's normal in normal people can cause serious complication. Clinical manifestation in patients may vary according to the area of the brain affected. For example, blurred vision, changes in mood or personality, or loss of balance. Third, inhibitor development. These complications are rare but have serious consequences. In this situation, the body will give a signal to the immune system to produce antibodies, inhibitors, to attack clotting factors in the treatment of hemophilia because they are considered foreign bodies, so that bleeding will be more difficult to handle. That's all from me. Thank you.
Hello, my name is Ayu Karralika Raidinjana with the last digit number 246. Next slide. And now I will be explaining about the treatment of hemophilia A. The first treatment is prophylaxis treatment, which is an infusion of plasma-derived drugs or recombinant factors to reduce bleeding. The second treatment is gene therapy. The continuous endogenous expression of clotting factors can eliminate breakthrough bleedings and microhemorrhages. And last, the therapy under development. The example is bone marrow transplantation and hematopoietic stem cell transplantation that are under trial in mice. That's all from me. Thank you.
Hello everyone, my name is Mulya with the last three-digit number is 151. Here I would like to present the prognosis of hemophilia. Hemophilia can affect lower motor skills and academics, emotional problems, and behavioral issues on a quarter of the children patients aged 6 to 8 years old. Although hemophilia cannot be fully healed, hemophilia patients still can have a full and productive life with appropriate education, lifestyle, and treatment they take. For example, prophylaxis and early treatment with 8 factor that can improve the hemophilia patients with protecting infection with viral agents, taking prophylactic therapy since young, trying to active in physical activities, and avoiding vitamin D deficiency. Thank you.
My name is Putu Krishna Arsawardani Putri with last 3-digit number 027, and I will summarize our presentation today about hemophilia A. Hemophilia A is an X-linked hereditary bleeding disorder characterized by a deficiency in coagulation factor VIII. Most hemophilia A is caused by mutation or defect of the F8 gene that encodes clotting factor VIII. However, hemophilia A can also be acquired due to malignancy and autoimmune disorders. Factor VIII is necessary for thrombin production and fibrin formation. Therefore, the deficiency of this clotting factor results in insufficient fibrin synthesis, which causes hemophilia symptoms to appear, such as hemarthrosis, hematoma, hematuria, mucous membrane hemorrhage, and dental bleeding. Next. Hemophilia A diagnosis is made when there is a known family history, severe and prolonged bleeding, or an abnormally extended activated partial thromboplastin time. The most common complication in hemophilia A is joint damage or hemarthrosis. Gold standard treatment for hemophilia is regular prophylactic treatment to prevent bleeding. In addition, gene therapy can also be done. Hemophilia A cannot be fully healed. However, patients can have a full and productive life with appropriate treatment, education, and lifestyle. That's all from me. Thank you.
Okay, my name is Ariela with last digit name 247. Now I will present about the recommendation of hemophilia A. Hemophilia A is likely underdiagnosed and often unrecognized due to limited data about incidence, diagnosis, and management. Due to its rarity, the diagnosis of hemophilia A might be overlooked. The rarity of the disease often results in significant delay in diagnosis and start of appropriate treatment, then further increasing morbidity and mortality. Comparative clinical studies are not available in hemophilia A, largely because of the rarity of the disorder, so further research on hemophilia A is still needed. We consume a lot of data about the topic by writing this research paper, and this brings us to develop and increase our knowledge. This paper also can be used as a source of knowledge, learning material, and educational purposes about hemophilia A. I guess that's all from our student project presentation about hemophilia A. We would like to apologize if there are any mistakes in our presentation, and thank you for your attention. We will close this presentation with Parama Santi, Om Santi, 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 Om.